Hello and welcome to The Explainer. Today, we're diving into a question that really pushes the boundaries of medicine and, frankly, human desperation. When a deadly new disease pops up and the clock is ticking, what are the rules, if any, for trying a completely unproven treatment? I want you to really picture this for a second. There's a virus, and it's spreading fast. There are no proven treatments, no cures, nothing. Now imagine you or someone you love is sick. A doctor comes in and says, look, we have something. It's totally untested in humans, but it showed some promise in a lab. We have no idea if it'll work or what it might do to you. Do you want to try it? What do you even do with that? This isn't just a thought experiment. It's the exact dilemma people face during crises like the Ebola outbreak. So here's our game plan. We're going to start by digging into that core dilemma. Then we'll look at the official ethical framework that's been built for these exact moments and break down the 7 really strict conditions that have to be met. After that, we'll talk about the wider responsibilities to the community. And finally, we'll see why sharing the results from these last-ditch efforts is so incredibly important. All right, so let's start by really setting the scene. It's a full-blown crisis, and the pressure is just off the charts. You know, in the middle of a deadly outbreak, the normal, careful, years-long process of developing a drug, that's a luxury nobody has. You've got patients who are desperate, searching for any little piece of hope. And you've got doctors who feel this huge ethical pull to just do something, anything to help. But they're also guided by that fundamental principle of first, do no harm. And that creates this awful tension between the need to act and the reality that there's just no evidence.
So how do you possibly navigate that? Well, it turns out there is a formal pathway for it, a framework designed for these exact kinds of desperate situations.
It's called MORI. It's a bit of a mouthful. It stands for Monitored Emergency Use of Unregistered and Experimental Interventions. But honestly, the name tells you pretty much everything you need to know. It's not just emergency use. Every single word there is key. It's monitored. The drugs are unregistered and experimental. So this isn't some free-for-all. It's a carefully structured framework put together by the World Health Organization to allow for compassionate use, but only, and I mean only, under very specific and controlled conditions.
And the whole idea behind MORI really stands on 2 big ethical pillars. On one side, you've got what's called patient autonomy. Basically, that's your right as a person facing a life or death situation to make your own call about the risks you're willing to take. But on the other side, you've got beneficence. And that's the duty of doctors and scientists to try and help, to give a patient any reasonable chance they can to feel better. MORI is the framework that tries to hold both of those things in balance.
But you can imagine opening the door to experimental drugs, even with the best of intentions, that's a huge deal. That's why the MORI framework is built on 7 really strict conditions. And you can't just pick and choose. Every single one of them has to be met. Yeah, think of these 7 conditions as a series of checkpoints you absolutely have to clear. First, you have the desperation checkpoints. There can't be any proven cure out there, and you can't possibly start a proper clinical trial right now. Then comes the science checkpoint. There has to be at least some lab data suggesting it could work, and a scientific committee has to give it the green light. Then oversight. Both the government and an ethics board have to sign off. And finally, the really critical patient-focused checkpoints. There have to be resources to give the drug safely. The patient has to give fully informed consent, meaning they know exactly what they're getting into. And all the data from the treatment has to be collected and shared. You miss one, the whole thing is a no-go. Okay, so even if all 7 of those conditions are met, the job isn't done. The responsibilities actually go way beyond just the one patient in that hospital bed. And this is just so important to get. MORI is a last resort for when a proper clinical trial just is impossible. It is not a shortcut. It is not a way to get around the rules. All the ethical oversight, the focus on patient safety, the quality of the data collection, everything has to be held to the same high standard you'd expect from a formal research study. And that forces you to ask some really tough questions. Is there still an ethics board watching over this? Are we truly doing everything we can to minimize the risks? Is the patient's consent really informed, especially when they're so desperate? Are we talking to the local community to build trust? And hey, what if the drug is scarce? How in the world do we decide who gets it fairly? All of these things have to be addressed. And that brings us to the final, and you could argue the most important piece of this entire ethical puzzle, the absolute duty to learn from the experience. I mean, this quote from the WHO guidance really just says it all, doesn't it? The deal you make, the moral contract, when you use an experimental drug on a person, is that whatever you learn doesn't just vanish. It has to be collected, analyzed, and shared with the whole world. And not eventually, rapidly and transparently. So what this really means is that a single patient's story, whether it's hopeful or tragic, becomes something much bigger. It becomes a critical data point. Whether the drug worked, whether it failed, whether it caused some totally unexpected side effect, all of that information is priceless. It helps the doctors treating the next person down the hall, it helps the global response right now, and it helps us build a stronger scientific foundation so we're better prepared for whatever comes next. This is how a single person's hope gets turned into our collective knowledge. Which really leaves us with this one powerful question to think about. In the middle of a crisis, how do we strike that delicate balance between the hope of one person and the need for solid science that benefits everyone? The Muri framework is a profound attempt to find an answer. It suggests that you can offer that chance, that hope, to an individual, but only if you also honor your duty to all of us. It's about making sure that even in our most desperate moments, we never, ever stop learning. Thanks for joining us.